Good day, nurses. So, alam kong pinindot mo to kasi alam kong may pangarap ka. Tama ba? Yes. Okay, so for today, we will talk about your antidiuretic hormone imbalances or the ADH imbalances. So, when we are talking ADH imbalances, I want you to think two disorders lang, guys. We have your SIAD and DI. Okay, pag sinabi nating increase ADH, guys, that's your SIAD. And pag sinabi naman natin decrease ADH, guys, that's your DI. Okay? So, your ADH, guys, or the antidiuretic hormone, di ba, sinabi natin ng first meeting, guys, na it is released by your posterior pituitary gland. Di ba, sinabi natin nung unang meeting natin, guys, that the posterior pituitary gland is dalawa lang ang nire-release ng hormone. That's your OA, di ba? Your oxytocin and the antidiuretic hormone to regulate fluid balance by affecting water absorption in the kidneys. Okay, so paano ba nangyayari yun? When we talk about your endocrine system, guys, its function is for your homeostasis. So, binabalance niya kung ano yung kulang or sobra sa katawan mo para makapag-function ka normally. So, paano nangyayari yun, guys? Okay, for example, you are dehydrated or your body is dehydrated. Now, ang ginagawa ng endocrine system mo, specifically si hypothalamus, guys, is magsesend siya ngayon ng message kay posterior pituitary gland to release an ADH. Now, kapag nag-release siya ng ADH, guys, yung ADH na yun, guys, syempre mapupunta sa bloodstream mo hanggang makaabot siya sa kidneys mo. Right? So, kapag nakaabot siya sa kidneys mo, siya na ang mag-enact nung na-release na ADH. So, ano ang ginagawa nung kidney mo, guys? Nire-reabsorb niya ngayon yung water papunta dun sa katawan mo. Hindi niya ini-excrete. Ganyan nangyayari ang ADH. Kapag increase ang ADH or kapag may ADH na napunta kay kidney, i-act niya yun, i-reabsorb niya ang water. Then, therefore, guys, yung water is nasa body mo. Tama? So, as a result, guys, decrease ang urine output mo. So, let's talk naman about your USG, guys, or when we say USG, guys, we are talking about the concentration of the urine or your urine. So, the normal USG level, guys, is 1010 to 1030 or 1.010 to 1.030. Tinawag ko lang siyang 1010 to 1030, guys, for you to easily memorize it, okay? So, kapag below the normal level, guys, meaning it is diluted. Pag above the normal level, guys, meaning it is concentrated. Okay? So, kapag increase ang ADH mo, guys, ngayon, madaming nagre-reabsorb ng water sa body mo. Tama? So, yung water is nasa body mo ngayon. So, as a result, guys, decrease ang urine output mo. So, kapag decrease ang urine output mo, guys, doon sa urine mo, guys, konti ang fluid. Mas madami ang solutes. That's why it is more concentrated. So, kapag kay decrease ADH naman, guys, meaning, guys, decrease ang ADH mo. So, walang nag-hold ng fluid sa katawan mo na i-excrete ngayon lahat ng fluid. Tama ba? Therefore, increase ang urine output mo. So, kapag increase ang urine output mo, then therefore, madaming fluid dun sa urine mo. Tama ba? Anong nangyayari, guys? Nadadilute ngayon yung mga solutes na nasa urine mo. So, it is less concentrated. And your ADH, guys, it affects this osmolality. So, when we talk about osmolality, guys, it is the balance of water to solutes in bodily fluids such as urine and blood. And higher concentration of solutes, guys. Ang example ng mga solutes mo, guys, is your sodium, glucose, and blood urea. That's your solutes, guys. Kapag increase daw ang concentration of solutes, guys, then therefore increase ang osmolality. So, paano mo siya mas maiintindihan? For example, guys, example natin kanina, you are dehydrated. Tama ba? So, you are dehydrated. In terms of urine, guys, kapag dehydrated ka, guys, therefore, increase ang urine output mo, di ba? Pag increase ang urine output mo, syempre wala kang fluid sa katawan, tama ba? So, you are dehydrated, tama? Now, increase ang urine output mo, right? So, sa urine mo, madaming fluids compared to solutes, tama ba? So, pag mataas ang fluid compared to your solutes, anong nangyari doon sa solutes, guys? Nadadilute ngayon yung solutes. So, meaning, guys, decrease ang osmolality. osmolality in terms of your urine. Right? So, pag si blood naman, guys, for example, you are dehydrated, sabi natin kanina. So, kapag dehydrated ka, less ang fluid mo doon sa katawan mo. Tama ba? Or sa blood cell mo, or sa blood vessel mo. So, decrease ang fluid doon. Now, so, konti lang ang H2O. Now, yung solutes mo ngayon ang mas nangingibabaw. So, ano ang nangyayari, guys? Nagiging concentrated ngayon si solutes. Sinabi natin kanina, guys, higher concentration of solutes is equal to higher osmolality. So, in terms of blood, kapag dehydrated ka, guys, increase ang osmolality. Okay? Hopefully, na-gets nyo yun, guys. So, the ADH disorder, so, SIADH and DI, guys, are characterized by fluid and sodium imbalances. So, yan lang ang focus natin kapag pinag-usapan natin ang SIADH and DI, the fluid and sodium imbalances. Okay, paano ko nasabihin, guys? For example, sa SIADH, sinabi natin kanina, si SIADH ay increase ang ADH. Okay, para mas mabilis yung matandaan, palitan natin si SIADH. Di ba si SIADH is your syndrome of inappropriate antidiuretic hormone. I want you to change, guys, the letter I. Gusto kong palitan nyo siya ng syndrome of increase antidiuretic hormone, at least para mas mabilis yung matandaan. So, kapag increase ang ADH mo, guys, then therefore, nako-hold ang or nare-reabsorb yung mga water doon sa katawan mo. So, mas madaming water ngayon doon sa katawan mo. So, ano ang nangyayari doon sa sodium mo, guys? Nang nadadilute siya. So, nagkakaroon ka ngayon ng dilutional hyponatremia. Mas mataas ngayon si H2O compared to your solutes. One of the example ng solutes, guys, that's your sodium. So, nadadilute ngayon yung sodium. That's why nagkakaroon ka ng dilutional hyponatremia. And kapag hyponatremic ka, guys, at risk ka ngayon for seizures. So, kailangan mo ring i-address mamaya yan doon sa intervention mo. And kapag mataas ang ADH mo, guys, then therefore, nare-reabsorb ang water. Tama ba? So, kapag nare-absorb ang water sa katawan mo, mas madaming fluid ngayon sa katawan mo. Kapag increase ang fluid, ano yung sinabi natin? Increase din ang pressure. That's why increase ang blood pressure mo. In terms of urine output naman, guys, di ba? Increase ang increase ang ADH sa SIADH, then therefore, nare-reabsorb ang water, right? So ngayon, wala kang naiihi kasi nare-reabsorb nga yung water doon sa katawan mo. So, decrease ang urine output mo. In terms of osmolality naman sa urine mo, guys, di ba sinabi natin kanina, kapag yung fluid is nasa loob, so then therefore less ang urine output mo, tama ba? So kapag less ang urine output mo, mas madami ang solutes mo ngayon doon sa urine mo. So, sabi natin kanina, higher concentration of solutes equals increased osmolality. And kapag decrease ang urine output mo, then therefore, concentrated ang urine specific gravity mo. Kasi mas nangingibabaw ngayon yung the solutes doon sa urine mo. That's why increase ang specific gravity mo. So, how about DI naman, guys? Diba sinabi natin kanina, kay DI, guys, is decrease ang ADH. Now, kapag decrease ang ADH, ano ang nangyayari, guys? Hindi nagkakaroon ng reabsorption of bodily fluids. Ngayon, ang nangyayari is na excrete mo ngayon siya through urination, right? So, konti ang tubig mo ngayon dito sa katawan mo. Now, ano ang nangyayari? Of course, guys, nagiging concentrated yung solutes. Mas nangingibabaw si solutes doon sa blood vessel mo. Tama? Sa blood vessel mo, nandyan yung mga solutes mo, right? So, for example, konti ang H2O mo. Then, solutes mo ay mas nangingibabaw siya ngayon. Now, ano ang nangyayari? Nagkakaroon ngayon ng hypernatremia. Nagiging concentrated ngayon yung mga sodium or the solutes doon sa blood vessel mo. That's why nagkakos siya ng hypernatremia. Now, decrease ang fluid. Ano yung sinabi natin? Of course, decrease din ang pressure. That's why nagkakaroon ng decreased blood pressure. So, ano yung sinabi natin? Pag decrease ang ADH guys, then therefore, walang nagre-reabsorb ng water. Tama ba? So, kapag walang nagre-absorb ng water, na-excrete lahat ng water through urination, then therefore, increase ang urine output mo. So, increase urination. Then, kapag increase ang urination, then therefore, sa urine mo, madaming fluid. Anong nangyayari dun sa solutes guys? Nagiging nadadilute sila. So, decrease ngayon ang osmolality mo. And also your specific gravity or the USG. So, kapag SIADH guys, it is soaked inside. And kapag diabetes insipidus guys, dry inside. So, in summary guys, sa SIADH or the syndrome of inappropriate antidiuretic hormone, too much ang ADH guys, then therefore nagkakaroon ng increase in water reabsorption. Now, resulting to your decreased output of concentrated urine and nagkakaroon ng fluid retention plus hyponatremia. And kay DI naman guys, or diabetes insipidus, konti ang ADH. So, then therefore decrease ang water absorption but increase ang output mo of dilute urine. So, anong nangyayari guys? Nagkakaroon ngayon ng fluid loss plus hypernatremia. Okay? Para mas maintindihan mo, i-compare pa natin siya ng i-compare. Okay, si SIADH guys, increase ang ADH mo. Tama ba? Si DI, decrease ang ADH mo. So, in terms of your ADH level guys, increase kay SIADH, decrease kay DI. And, in terms of urine output mo guys, kapag increase ang ADH, nagkakaroon ng water absorption sa body mo. Wala kang na-excrete sa urine mo. So, decrease ang urine output mo. And kay DI, konti ay walang water absorption na nangyari, na-excrete mo lahat sa urine mo through urine. So, increase ang urine output. In terms of urine sodium plus osmolality naman, di ba si SIADH guys is, yung water is nare-absorb doon sa katawan mo. Right? So, doon sa urine mo guys, decrease ang water. So, anong nangyayari sa solutes? Nagiging concentrated. Diba? Sabi natin kanina, higher concentration of solute equals higher osmolality. That's why increase kay SIADH. And kay DI naman guys is decrease kasi nga walang water absorption na nangyayari. Na-excrete lahat through urine. So, meaning, mas madaming water ngayon doon sa urine mo. So, ano ang nangyayari sa urine mo guys? Anong nangyayari sa solutes doon sa urine mo guys? Nagiging diluted siya. So, meaning guys, decrease ang osmolality in terms of DI. And in terms naman, kay serum sodium plus osmolality, kay SIADH guys, di ba nare-reabsorb yung water guys. Now, mas madaming water doon sa blood vessels mo or sa body mo. Ngayon, anong nangyayari doon sa mga solutes? Doon sa blood mo ngayon guys or sa blood vessels mo, nagiging diluted sila. That's why decrease ang serum sodium osmolality mo. And kay DI naman guys, di ba konti ang water absorption, ay ihi mo lahat, then therefore dehydrated ang blood vessel mo or mga cells mo, then therefore guys, nagiging concentrated ang mga solutes mo, sa specifically your sodium. So, nagkakaroon ng hypernatremia. Tama ba? So, increase ang serum sodium plus osmolality mo. And in terms of intravascular volume, of course, kay SIADH guys, nagkakaroon ng water retention. Then, therefore, pag mataas ang water retention, increase ang fluid. Pag increase ang fluid, ano yung sinabi natin? Increase din ang pressure. That's why, increase ang BP or increase ang intravascular volume mo. And kay DI, of course, na walang water retention na nangyayari, na-excrete through urine yung mga fluids, then therefore, decrease ang intravascular volume mo. And lastly guys, in terms of fluid balance naman guys, kay SIADH guys, there is a fluid retention. So, as a result guys, nagkakaroon ng fluid overload. And kay DI naman guys, di ba syempre, ihi ka ng ihi. Now, anong nangyayari guys? Of course, fluid loss and dehydration. So, that's the comparison of your SIADH and DI. Now, let's talk naman about the SIADH muna. Okay? Dig pa natin si SIADH guys. Si SIADH guys, ang nangyayari is too much ang ADH. So, kapag too much ang ADH, then therefore there is a water retention. Kapag may water retention, there is a dilutional hyponatremia plus fluid volume overload na mangyayari. Kasi nga nare-retain yung water. So, your SIAD guys is caused by excess ADH secretion. Di ba, na-discuss natin to nung first meeting from your hyperpituitarism, from small cell lung cancer, brain injury or trauma, or medication such as chemotherapy and antidepressant. So, what are the assessment findings ngayon na makikita mo sa SIAD guys? Now na you understand the pathophysiology behind the SIAD na. Of course guys, di ba kapag si SIAD increase ang ADH, so there is a water retention na nangyayari. So, as a result guys, syempre mag-weight gain ka but without edema. And, nagkakaroon ng water retention, less ang urine output. And, concentrated ang urine mo guys kasi nga less ang due to your less urine output. So, increase ang urine specific gravity mo. And also guys, nagkakaroon ng dilutional hyponatremia kasi nga there is a water retention. Mas maraming fluid ngayon doon sa blood vessel mo. 'Di ba? Yung sinabi natin kanina, pag maraming fluid sa blood vessel mo, then therefore nadadilute yung solutes. One of specifically your sodium. That's why nagkakaroon ng dilutional hyponatremia. So what are the signs and symptoms naman na may na hyponatremic ka na? Kapag there is headache, confusion, or seizures. So what are the nursing interventions guys? Now you understand the pathophysiology and the assessment findings of your SIAD. So care for clients with SIAD guys focuses on 2. Managing fluid overload and preventing complications of severe hyponatremia. So, fluid overload and severe hyponatremia lang ang pag-uusapan natin in terms of your SIAD. So, first, we manage fluid overload. So, paano natin siya i-manage guys? You need to measure the intake and output and daily weights. So, alam nyo naman na yan guys, sa pag-monitor ng daily weights, alam nyo na, same time, same scale, and same clothes, right? Then, assess for signs of fluid volume overload. So, upon auscultation, nakarinig ka ng crackles and therefore possible na may nangyayaring fluid volume overload. And kapag nakita mo na distended ang jugular vein niya, then therefore possible there is a fluid volume overload. And kapag bounding pulses si patient, kapag may bounding pulses si patient, so it is a sign guys na may fluid volume overload. Diba sabi natin kanina, kapag increase ang fluid and therefore increase ang pressure. That's why guys nagkakaroon ng bounding pulses. And you need to restrict guys the fluids to less than 1,000 ml per day. So, paano naman guys, kapag nauuhaw na si patient and i-restrict natin siya sa fluids, so kailangan mo lang mag-provide guys ng chewing gum, ice chips, and oral care to manage thirst and dry mouth. What else guys? To manage the fluid overload, you need to administer vasopressor antagonists guys, such as your conivaptan and tolvaptan. So, ano bang ginagawa niya yan guys? Binablock niya si ADH guys na mag-release. Diba? Ang problema kasi natin kay SIAD guys is increase ang ADH. So, si vasopressor antagonist guys or such as conivaptan and tolvaptan, i-block niya yung pag-release ng ADH and ini-increase niya ang diuresis without sodium loss. Then, pwede ka ring mag-administer ng diuretics guys such as furosemide. Diba ang ginagawa ng diuretics guys is nag-excrete siya ngayon ng fluid. Diba? But you need to use it cautiously guys. Why? Because of the risk of hyponatremia. Kasi di ba kay SIAD, hyponatremic ang patient natin. So kapag gumagamit ka ng diuretics guys, you need to use it cautiously. Number 2, intervention guys is to prevent complications of severe hyponatremia. So paano natin gagawin yan guys? You need to perform frequent neurological assessment such as the orientation and grip strength. Okay, paano ka magiging objective in measuring your neurologic or how can you assess neurologic guys? In terms of neurologic, diba? Ang ginagamit natin na tool dito guys is your GCS or the Glasgow Coma Scale. Then you need to implement safety measures guys like seizure precaution. Diba sinabi natin kanina, at risk si patient for seizure. So, what are the interventions guys or the safety measures guys or precautions ng seizure guys is padded bed rails. So, itaas mo yung side rails and lagyan mo ng pad and kailangan yung height ng bed is nasa lower position and kailangan yung mga mech vents ganyan or oxygen is ready. Okay? And what else guys? To prevent stimulation naman guys, kailangan mag-use ka ng dim lights and kailangan nasa peaceful na environment si patient mo to avoid the seizure. What else guys? You need to monitor serum sodium levels and serum urine osmolality closely. Kasi yun nga yung mga problema natin, right? Yun nga yung mga labs na problema natin. So you need to monitor that one guys. Then encourage client to consume high sodium foods. Kasi nga, di ba, there is hyponatremia na nangyayari. So high sodium foods temporarily as ordered. O ano ba yung mga high sodium foods natin guys? Such as canned goods and luncheon meat. For severe hyponatremia naman guys, you need to administer IV hypertonic saline or your 3% sodium chloride. But you need to infuse very slowly to avoid rapid fluid shifts because rapid fluid shift can cause life-threatening brain damage and heart failure. Okay, paano ba nangyayari to? Di ba when we say hypertonic guys, sinishrink niya yung cell. Pag sinabing hypotonic, sineswell niya yung cell. Okay, paano ba nangyayari yun guys? Ganito siya. Okay, pero alam niyo naman na to guys, i-discuss ko lang para sa mga hindi nakakaalam. Okay, di ba sa SIADH sinabi natin there is a water retention na nangyayari. So, there is a lot of water. This is your blood vessel, okay? Then, meron mga cells dito, di ba right? Madaming mga cells dyan. So, yan yung blood vessels mo. Then, madami ang H2O mo compared sa mga solutes mo. So, the concentration doon sa blood vessel mo guys is hypotonic. Right? Mas madami ang H2O. So, nagsweswell siya. So, as a result guys, yung mga H2O dito na madami guys is pupunta ngayon sa mga cells mo. Specifically your brain cells. So, pag madaming fluid doon sa brain cells mo guys, magkakaroon ka kasi ng cerebral edema. So, the brain now guys will swell. So, what are the signs and symptoms guys kapag may headache, confusion, seizures, and possibly coma guys kapag severe? So, in severe SIAD, we must increase sodium fast but safely. So, nagbibigay tayo ng hypertonic saline solution because the concentration sa blood vessel mo or sa cells mo guys is hypotonic, di ba? So, you need to administer hypertonic guys to shrink now guys. To shrink the blood vessels. Now, shrinking the cells na mga nandun sa tabi ng blood vessels mo. So, kapag nagbigay kasi ng hypertonic mo, di ba si hypertonic guys is nakakapag-shrink siya. So, ang nangyayari guys is dinidecrease niya yung mga H2O mo. H2O. So, nagdi-decrease yan guys. And nagbabalance ngayon ang solutes and your fluids. Ganun ang nangyayari kay hypertonic saline. So, increase sodium level. Now, kapag nangyari yun guys, kapag shrink niya or dinicrease niya ang H2O doon sa blood vessel mo, of course, magi-increase ang level in your sodium level in the bloodstream. Makes blood more concentrated. So, nagiging hypertonic na siya ngayon guys. So, the water moves out of brain cells. So, kapag na-remove na yung mga water guys, ma-remove na out of brain cells, mapupunta siya ngayon doon sa bloodstream mo guys. So, as a result guys, the brain swelling decreases and neurologic symptoms improve. So, ang ginagawa ng hypertonic saline, basically guys, di ba, sinishrink niya. So, pulling H2O or the water out of swollen brain cells. That's why we are giving hypertonic saline or the 3% sodium chloride. Okay. Now, let's talk naman about your diabetes insipidus. Okay, when we say DI guys, or diabetes insipidus, ibig sabihin too little ADH or poor response to ADH. Kidneys cannot concentrate urine, so there is excessive water loss. So, there is, as a result guys, may nangyayaring hypernatremia plus dehydration. So, there are two types of DI guys. Your central and nephrogenic. When we say central guys, basically, lack of ADH ang nangyayari. So, when we say central guys, ang problema guys is na kay posterior pituitary gland. And when we say nephrogenic guys, the kidneys don't respond to ADH. So basically, si kidney ang may problema. So this one guys is primary and this one guys is secondary. Paano yun ba guys? Kapag ito ang problema guys, tinatawag siyang primary. Later on, matidiscuss ulit natin kasi kay thyroidism yan guys. Kapag ito ang problema kasi guys, meaning it is secondary. Okay. Balik tayo guys. Okay, so, causes guys ng DI mo naman guys includes hypophysiectomy or head trauma, brain surgery, pituitary tumors, and the kidney disease. Actually, na-discuss naman natin yan nung first meeting kay hypopituitarism. So, what are the assessment findings or ano yung mga makikita mo in terms of diabetes insipidus guys? Of course, decrease ang ADH mo, then therefore walang retention na nangyayari or walang water retention na nangyayari. So, as a result, increase ang urine output mo. So, polyuria, 2 to 20 liters per day. And syempre guys, kung marami kang na-excrete na urine, then therefore, possible na mangyari ang polydipsia or increased thirst and dehydrated ka of course because madami kang na-excrete na urine and diluted ang urine mo guys. So as a result, decrease ang urine specific gravity mo. Ang sabi ko, polydipsia and dehydration, right? So what are the signs and symptoms na dehydrated ka? Kapag dry mucous membranes, hypotension, and tachycardia. But tachycardia guys because as a compensatory mechanism, and this is the earliest sign of your shock, right? So what else guys na dehydrated ka? Kapag sunken ang fontanelle, right? And of course guys, there is a hypernatremia na mangyayari kasi nga konti ang fluid, walang water retention na nangyayari, dehydrated ng fluid doon sa blood vessels mo, resulting now guys na maging concentrated ang mga solutes. That's why hypernatremia ka kay DI. So what are the nursing interventions naman guys? Care for clients with DI focuses on 2 ulit guys, managing the dehydration and preventing complications of DI. Okay, so first we manage dehydration. So you need to monitor dehydration and hypovolemic shock such as decreased BP and increased HR. O alam niyo naman na ang mga signs ng dehydration, nasabi ko naman kanina, right? So you need to measure intake and output and daily weight. So alam niyo na rin kung paano mag-weigh, right? Then, syempre, dehydrated si patient guys, you need to increase the oral fluid intake ni patient. So, and also guys, you need to administer hypotonic IV fluids like half-strength saline or your 0.45% NaCl or sodium chloride. So, paano ba nangyayari yan guys? Diba? For example, kay DI kasi guys is dehydrated ka, right? So, konti ang H2O mo. So, the blood guys becomes concentrated. So, yung mga solutes such as your sodium guys doon sa bloodstream mo is nagiging concentrated sila. Resulting now guys into hypernatremia. And ano pang nangyayari kay DI guys? The intravascular volume guys is nagda-drop. So, nagiging dehydrated si patient and hypotensive. And also guys, dehydrated ang cell. O, diba ang sinabi natin kanina, kapag hypo, it swells. Right? So, you need to give hypotonic IV fluids guys or 0.45% sodium chloride para mag-add siya ng free water to the bloodstream. So, mag-i-increase ngayon ang H2O. Dito daw. Sa blood vessel mo muna. Sa blood vessel muna guys. Sa blood vessel. Then, mag-i-increase din ang H2O dito. And also into your bloodstream. Then, of course guys, kapag increase na ang water mo dun sa blood vessel mo, pati sa mga cells mo, then therefore madadilute na ngayon yung mga urine. Madadilute na siya. Yung sodium level pala guys, madadilute na ngayon yung mga sodium kasi madami na ulit water. Then the water moves from blood into dehydrated body cells. So, yung mga water mag-moves out dito kay dehydrated cell. Marami pang cell dyan. Punta sila dyan, punta na sila dyan, ganyan. So, it rehydrates now your tissue and organs. That's yan yung pathophysiology ng hypotonic IV fluids. Actually, alam niyo naman na yun guys. Ni-recall ko lang kayo. Okay? Then, what else guys? Last intervention is preventing complications of DI naman guys. So, you need to monitor serum sodium levels and urine or serum osmolality closely. Then, restrict sodium intake. Kasi nga, di ba, there is hypernatremia na nangyayari. So, restrict sodium intake to less than 2 gram per day. Then, you need to prepare for pituitary gland removal or the transphenoidal hypophysiectomy. Now, magtataka kayo ngayon guys, di ba? Sabi natin, kay DI is decrease ang ADH. So, bakit matatanggalin si pituitary gland? Siya ang nagre-release ng ADH, right? Bakit magagawin yun? No guys, the transphenoidal hypophysiectomy guys is, ang ginagawa niya lang guys is to remove the tumor which is the cause of your DI. So, yung tumor ang nire-remove niya guys. So, paano ginagawa yun, guys? The transsphenoidal surgery. So, mayroong ipapasok na endoscope. So, there is camera. So, when you say scope, there is camera, right? And merong curette. Siya yung magkakat papunta doon kay posterior pituitary gland. Yung endoscope is para sa guide. And si curette naman na yung magkakat. So, post-procedure ng transsphenoidal surgery, guys, you need to monitor for worsening DIY. Bakit? Kasi nga, the tumor, guys, is nandoon sa posterior pituitary gland. Now, possible, guys, na during surgery is magalaw yung posterior pituitary gland. Tama ba? So, possible, guys, na mag-worsen ang DI. And test for nasal drainage for glucose, which indicates CSF leak or cerebrospinal fluid leak. So, paano mo gagawin yun, guys? Kailangan mong kumuha ng tissue or clear na cloth. Then, punasan mo yung nasal drainage ni patient. Then, tignan mo na ngayon doon sa clear na cloth or tissue, guys. Kung may halo kang makita, that's the indication, guys, na may glucose. So, it indicates now, guys, na may cerebrospinal fluid leak na nangyayari. And in nephrogenic DI naman, guys, so sa kidney ang problema. So, it is primary, right? So, you need to administer thiazide diuretics to decrease urine output by causing mild fluid loss, prompting now the kidneys to reabsorb more water and sodium earlier in the tubules. And for central naman, guys, meaning it is secondary, right? Hindi siya nagre-release gaano ng ADH or lack siya ng ADH. You need to administer desmopressin, guys, or the DD-AVP to increase now the HDA levels. Pero pag administer ka ng desmopressin, guys, di ba ini-increase mo ang ADH levels mo. So, you need to monitor for signs of hyponatremia. Kasi baka possible, guys, na nag-turn siya into SIADH kasi nga nag-i-increase siya ng ADH levels ang desmopressin. So, you need to monitor for signs of hyponatremia after desmopressin administration, such as weight gain, headache, and confusion. And that's your SIADH and DI. Thank you.